for being here today and sharing your story. The Jobs 2.0 budget. That's what John Kasich and the legislative leaders called this budget. Well, I've been a healthcare attorney for over a dozen years, which means I put doctors' practices together. I help to make sure doctors have jobs in the state of Ohio. And in fact, when I got elected, I thought evidence-based policies would create bipartisanship in the legislature. Unfortunately, I've been wrong with respect to that, especially as it relates to Governor Kasich and the legislative leaders. Doctors and women. Governor Kasich believes he knows better than you what is best for you and your family. In fact, even though the governor never attended medical school, residency, or fellowship training, he has now signed laws that criminalize evidence-based medicine in Ohio. I call on all doctors and patients in Ohio to call Governor Kasich, to write Governor Kasich and members of the legislature and say in one collective voice, get out of our exam rooms, get out of our delivery rooms, get out of our surgery suites. Physicians from all specialties agree that the sanctity of the physician-patient relationship is central to good medicine and is embraced by the American Congress of Obstetricians and Gynecologists, the American Academy of Pediatrics, the American Academy of Family Physicians, the American College of Surgeons, and the American College of Physicians. These organizations recently wrote in the New England Journal of Medicine, legislators regrettably often propose new laws or regulations for political or other reasons unrelated to the scientific evidence and counter to the healthcare needs of patients. Legislative mandates to the practice of medicine do not allow for the infinite array of exceptions where the mandate may be unnecessary, inappropriate, or even harmful to an individual patient. Women can make their own medical decisions without state interference. Women across this nation are fully capable of making their own medical decisions with their physicians, just as they make many other important decisions every day for themselves, their families, and their businesses. Women do not need, nor do they want, any government to make medical decisions for them. As I've indicated, Governor Kasich is neither a doctor nor a medical professional. The governor and legislative leaders' actions demonstrate that they believe that medical science is the enemy of good public health. In fact, the proponents of the measures we are discussing testified that they neither provide healthcare services nor did they talk to any healthcare providers when they crafted this anti-evidence-based provisions that ended up in the legislation, the Jobs 2.0 budget. These changes will drive up the cost of providing healthcare in Ohio, and by criminalizing the practice, it will make it much less attractive for doctors to even want to practice here in the state of Ohio. It is time that the doctors and the patients of Ohio say with one collective voice, get out of our exam rooms, get out of our delivery room, get out of our surgery suites. Medical science should lead the way. Patients with their doctors should make decisions that are in their best interest. We shouldn't have a governor who has no training and no right to be in those rooms to be dictating to our healthcare providers what they should be doing. Thank you very much. I'll hand it back over.